I couldn't see an end. I didn't know when it was going to be gone. And you would do something and it would clear up like for a day and then it'd be back as bad as ever.
Being a teen is tough for a lot of reasons, and acne is a big one. According to the American Academy of Dermatology, almost every teen will develop some form of it. But today, doctors and parents have an arsenal of weapons, from over-the-counter remedies to prescription drugs, that help teens attack acne. On the lacrosse field, 14-year-old Karsten Bench is in constant motion, working hard to help his team gain control of the game.
How are things been going with your skin?
Off the field, Karsten is fighting to gain control of another opponent, acne.
It used to come up around on my forehead, but now it's just mostly down here.
I tell all my patients that 100% of people get acne, and if they get through their teenage years without acne, they usually are the ones that end up with adult acne.
But breakouts can break down a teenager's self-esteem.
Times when you're just kind of like, you know, I wish this go away.
It's embarrassing. Like younger kids, they would be like, what's wrong with your face?
Acne is primarily a hereditary disorder. There are certain things that will make acne worse, and one of those is stress, and the other is hormones.
Today, a menu of strategies can help prevent, control, and even cure teen acne.
The treatment of their acne really does depend on the severity and also on their skin type.
Microcomedones are tiny pore-clogging plugs made of oil, skin, and bacteria, and they become abundant during the hormone-changing teen years.
They really do need some sort of ongoing treatment, ongoing medication to help to keep the pores unplugged so that the acne doesn't develop.
Over-the-counter remedies with ingredients like benzoyl peroxide and salicylic acid are often the first line of defense.
When you get, very minimal amount of bumps, there's
14-year-old Paige Barada needed stronger medicine to clear her pores.
I bought just over-the-counter products, and I was using those for a while, and that helped a little bit, but it just got worse.
When you have an increased number of comedones that the over-the-counter products can't control, that's the time to discuss with your doctor a prescription for a topical retinoid.
And that's exactly what Paige and her parents did. She was prescribed a retinoid.
Retina-A is an old product, but now they have Retina-A Micro, for instance, which the Retina-A is in these little micro spherical particles, and it actually releases the Retina-A over a period of time.
It makes the medication easier for more patients to tolerate.
If you use a microsphere, people have less redness, less irritation, so they're a good thing to use.
There are other strategies too.
A lot of people also have inflamed bumps or cysts with their acne. So they will need a topical antibiotic or even an oral antibiotic if that acne is deeper in the skin.
Topical antibiotics can be combined with ingredients like benzoyl peroxide.
Low-dose oral antibiotics is showing signs that it may help to be as effective as the higher doses without some of the potential side effects.
These strategies act like a suppressive blanket.
Hopefully towards the end of their acne years we try to sneak away the blanket, and hopefully that we've gotten them through their worst years. You're getting some spots here. We still don't know what makes somebody go from pretty typical superficial whitehead and blackheads to very inflammatory lesions.
In those cases, doctors sometimes prescribe
isotretinoin, which of all the medications is the most powerful medicine for acne.
Because isotretinoin carries potentially serious side effects, including liver damage and birth defects, the FDA has implemented strict guidelines, including a mandatory monthly pregnancy test for females who take it.
Are you having any problems, any headaches?
15-year-old Clayton Bailey is on his last month of treatment.
Your cheeks and chin, they look fantastic.
Cysts on his face and back are nearly gone.
I don't have to really worry about getting a bunch of pimples on my forehead when I wake up, and it's just a lot easier on me.
And as with everything, regardless of the treatment, parents can push a teen to succeed.
Parents really have to have a hands-on approach, almost catching a kid before they run out of the house, sticking a pill in their mouth or putting a cream on their face.
The right therapy, consistent use of the medication, and parental involvement can prevent teen acne, control lesions, and stop the most severe cases.
1, 2, 3, go!
Strategies that are helping Karsten get his mind off his skin and back on the game. Parents need to know early treatment is critical to avoid scarring. So if the over-the-counter remedies aren't doing the trick, have your child see a dermatologist right away.